Hello, my name is Isioma. Many people call me Izzy. I'm a medical doctor specializing in obstetrics and gynecology. And today I'd like to speak to you about an issue that I think is at the forefront of many of our minds and has certainly been at the forefront of my mind, particularly triggered by a conversation I had with my brother this morning. So I was out on my run. I'm in the middle of retraining for a marathon because I was meant to be doing my first marathon in April, but it was cancelled. And the reason I'm training for a marathon is because I want to get into the Boston Marathon, and to do that you need a very good time. I made a promise to myself that I would run the Boston Marathon if I was successful in securing a research fellowship, and that's what I'm doing. So I want to take this opportunity to thank everybody who has been supportive to me in my journey towards getting this fellowship, and thank you so much for the kind words, for the encouragement, for the letters of reference. Thank you for the funding, thank you for the money donated. I'm very grateful. So, just before going out for my run, I was speaking to my brother who's 19, and we were talking about the masks people wear to protect themselves from the Covid-19 virus, the homemade ones. And he made a comment that really struck a nerve with me. He said that the scarves and the bandana masks were not an option for him as a black man. And of course, this is in reference to recent horrendous events in the States. By this I mean the unjustified gunning down and murder of a young man, Ahmaud Avery, and I pray for justice and peace for his family. And again, this is related to recent headlines that we've seen in the United Kingdom about how Black, Asian, and ethnic minority people are more likely to become critically unwell and die from COVID-19. So they are overrepresented in the morbidity and mortality statistics related to this disease. And the thing about this statistic is, though shocking for many of us, it is not new. And that's what I'd like to talk about today. Very briefly focusing on some of the factors that have been put forward as reasons, but I'd like to focus more on what I think we should all be doing about it, and certainly what I will be doing about it. So I've read quite widely around the subject, and as well as looking into the literature, I've read expert opinion on the issue. And it's important to acknowledge that this is changing every day. So because of the focus on the current issue, there will be inquiries into this and more research that goes into this, which we welcome. And reflecting on what I've read so far, I have classified the reasons put forward as individual risk factors, community risk factors, and then risk factors to do with the society and the world at large. So bear in mind, I am neither refuting nor supporting these. I'm just presenting my reflections. So at the individual level, things that have been put forward are to do with pre-existing medical conditions. By this I mean cardiovascular disease, respiratory disease, hypertension, kidney disease, and uncontrolled diabetes. So these are diseases that we know will increase your susceptibility to COVID-19 disease, diseases that perhaps feature more prominently in Black and Asian populations. We do know as well that if you are overweight or obese, your risk, if you contract COVID-19, is higher in terms of how severe the disease might be. We know, of course, that being over a certain age makes you more vulnerable as well. Other factors I've come across are theories to do with vitamin D deficiency. So we get vitamin D from the sun, and for those of us that live in Scotland, we're really lacking in that. But particularly if you are black or brown, absorbing vitamin D from the sun is particularly difficult. Now, there have been studies, quite robust studies in the past, which have shown a correlation with vitamin D deficiency and respiratory disease, specifically tuberculosis, and certainly in the reactivation of latent tuberculosis. The evidence there is pretty compelling. There has also been some research put forward with regards to ACE receptors. ACE stands for angiotensin converting enzyme, and this is an enzyme which is involved in the control of our blood pressure. And so it attaches to this receptor in our body, and there are some medications which are used in treating hypertension, cardiovascular disease, and diabetes, which act against this enzyme. And there is some evidence which shows that there is a correlation between the number of ACE receptors and your susceptibility and severity of the disease. So then going on to the community level, I came across a really problematic narrative around this idea of the mythical immune black person. I think this is obviously all preceded what we now see today in terms of the numbers and the disparity. But there was some idea being bandied around about how black people are immune to COVID-19. And I mean, I wonder if perhaps this affected how people's personal perception of their risk and perhaps affected how they accessed healthcare, and perhaps when they did access healthcare, it might have affected how they were treated. I don't know, but this narrative is very problematic. At the community level as well, something that has been put forward is the issue of intergenerational living. So those are generations of the same family living in the same household makes social distancing very difficult. There's more people in close proximity, higher chance of spreading and contracting the disease. Other things that have been put forward are cultural barriers, which may affect how people of Black, Asian, and ethnic minority groups access healthcare and their perception of how they'll be treated when they access healthcare. So moving quickly on to the society and world at large area, which I am particularly interested in. Some people would argue that these statistics we see are just merely a surrogate, and by that I mean a manifestation of a lifetime accumulation of disadvantage. And this manifests in differential opportunities and exposure when it comes to education, healthcare, employment. And indeed, as an obstetrician, I know, we know in reproductive health that Black and Asian mixed race women have poor reproductive health outcomes, and that's throughout their life cycle. Particularly in maternity, we know, for example, that Black women are 5 times more likely to die in pregnancy. So again, this all relates to what I said earlier, this statistic is not new. So the question then is, what are we going to do about it? In answering that question, what do we do about it? I want to acknowledge something very important. So as a collective human consciousness, we are grieving. Some of us are grieving the loss of friends and family due to the disease or other medical conditions. But as a collective consciousness, we are grieving the loss of normality. And for those of you who have gone through bereavement, you will know that, one swings from the various points, be it depression, denial, anger, bargaining, and finally, ideally, acceptance of the condition and situation. But being in a state of bereavement currently makes addressing such important issues even harder. I also would like to acknowledge the fact that I understand that for people who do not identify as Black, Asian, or ethnic minority groups, sometimes speaking about these issues is challenging and difficult. Sometimes you perhaps might feel that you are not entitled to have an opinion about these issues because you are not Black, Asian, or you do not identify as an ethnic minority. Perhaps you worry about being out of tone. Perhaps you worry about political correctness. And I wonder as well if in discussing these issues, consciously or subconsciously, feelings of guilt creep up. I acknowledge these are all part of the human spectrum of emotions and entirely normal. But in the end, I believe intent and context will keep you right. And it all begins with deciding to do something. And the decision is an active one. The other thing I'd like to highlight is focusing and promoting issues which affect ethnic minority groups disproportionately does not take away from the rest of society. So being pro-Asian or pro-Black does not mean you are anti-white. In the same way, being pro-female doesn't mean you are anti-male. I'm a big believer in the concept of equity as opposed to equality, because equity is realistic and acknowledges that the level playing field is in fact a slope. And I think the beauty about equity is that it focuses on the individual. It avoids a cookie-cutter template, cut and paste approach to providing care. And it also avoids unnecessary wastage of resources, because you essentially provide unequal resources for people with unequal needs. So in deciding to do something, you are choosing to be an ally and an advocate. And you are deciding to acknowledge that this is a problem and it has been a problem, and it will continue to be a problem unless we do something about it. We speak about it. We speak about it with our friends and our family. We spread the concern. At work, how do we be allies? We have a discussion with our managers, our line managers, about what steps are being taken to ensure those who are the most vulnerable are being kept safe. If that is you as an individual who identifies as Black, Asian, and ethnic minority, or you have some pre-existing medical conditions, we should be having these conversations with our superiors and the authorities. As an advocate of somebody who is vulnerable, you can also inquire and speak about this on their behalf. How else do we express our power as individuals? We can write to our MPs, and indeed you can write to the Prime Minister as well, expressing your concerns, insisting that this is kept on the agenda. You know, thankfully, there have been pledges that there will be inquiries into the issue and hopefully research that goes into the issue, because we must acknowledge that this pandemic will come to an end, but the issues and the factors underlying disparities in healthcare, be it racial, gender, socioeconomic, will not come to an end unless we keep it on the agenda and keep the interest alive. And finally, put your money where your mind and your mouth is. Support causes which you think uplift and improve the well-being of individuals who are most vulnerable to this disease. So that's all I have to offer in my humble opinion. I'd share this if you think this is useful. I've obviously spoken from a United Kingdom perspective. I would like to hear what people in the United States, people in India, China feel that can be done in their local context to address these issues. But most importantly, I hope you all stay safe, stay healthy, wash your hands, and look after each other. Bye for now.